I want to run through this document pretty quickly and then come back and hit the stronger points. So we'll kind of buzz through this. The background on this document is I digested a much larger document that I got from the state on the things that the state and the feds are looking at in relationship to COVID and what a return to normal might look like. So this was a document that they were reading, and I just kind of broken it down into something that's a little more manageable here. So they're looking at a 4-phased approach. Currently we're in phase 1, slow spread. Phase 2 is a state-by-state reopening. 3 is lifting the physical distancing completely. And phase 4 is readiness for the next time we have something like this. So we'll spend most of our time talking about phase 1, phase 2, and a little bit from phase 3. Phase 1, we're already working these things. We're slowing the transmission. We're seeing that already. Increasing testing capacity, that is something that's coming from the state. We're not quite there yet. Ensuring that we have the capacity to treat both COVID patients and others requiring care, we're there. We've got that capability in the community, so we're doing pretty good on that count. And then, of course, the last one, the goal of that is all to save lives, and I think we can see that by our low rates we're having here in Mason County. So I think phase 1, the main goals of this, we're hitting them. Phase 1, steps required is this document with all the different steps, and these aren't in any particular order. These are just things that just are factors that we're looking at. So maintain physical distancing, increase diagnostic testing, which is obviously that's the next big thing we're working on. Data infrastructure. So the state has had problems with its data infrastructure. As we've seen, they've crashed a couple of times in WDRS, which is this Washington Disease Registry System, crashed over the weekend. And they've had to take out putting negative cases into that because there just got to be so many new pieces of data that the system wasn't holding up. Locally, our system is working pretty well, but we generate it ourselves and kind of run ourselves, and it works pretty well. Ensure a functioning healthcare system. I think we're there. Between Mason General and our other partners, we've got a functioning system with enough capacity in reserve to handle anything that we've got that may come towards us. We are working on increasing our supply of PPE, so we've almost doubled what we've had in the last couple of weeks, to include putting some out. Just as an example, the Sheriff's Office had an order that came in for the Sheriff's Office, for the jail, and that was their piece. But we've had a lot of donations, and stuff's kind of coming out of the woodwork. One of the things we're doing is we're taking some of our oldest stuff, using it first, and taking our freshest stuff and putting it to the back. So to keep that stock rotated.
We should receive a small shipment today.
Right, right. Comprehensive COVID.
Which will be on TV.
Yes.
So it'll be channel 7, I believe.
So I just hope it's not a guy who comes out of a truck with like a stack, you know.
What do you mean? What do you mean it's on TV?
Well, they were asking for a lot of people. So people are getting shipments, but a lot of these other places do not want to be on the television. They don't want to be seen that they're getting anything, is how I took it.
Mm-hmm.
And so they contacted Mason County because they heard that we were going to get something, and our PIO said, sure, we'll do it.
So it's going to be like a pallet, maybe.
Right, it won't be a lot.
It won't be a lot.
But anything helps at this point.
Right, right.
It's mainly, I think, gloves.
Yeah, 3 different sizes of gloves and some sanitizer wipes. So, and gowns.
And gowns, which they're going to contact the hospital to see if the hospital needs those gowns,
Right.
because the hospital is short.
That is the one thing the hospital is shortest on. So we do have those things coming in. Surveillance, that's being run through public health, and they're doing a crackerjack job down there of staying up on top of the case investigation and working that piece through.
I went over Friday to talk with our nurses. They are amazing. And the people that they contact, they develop a relationship with them. And it's just, it's so cool to see and to hear them talking to the not just the patient, but the people that they had contact with. You know, they're asking them if they need anything, you know, how can they help, and you can just feel the compassion that they have for all of those people that they're talking to.
And some cases are very simple. Some cases, they've known and they've self-quarantined and they got their test and they've done everything right with next to no contacts. And in other cases, there are a slew of contacts. And it may take all day of doing interviews to get, to try to trace all those contacts.
But at least we're low enough on how many we have that we're able to continue to do that. Other places gave up.
Right.
You know, even things on here in the Kids app, they gave up a long time ago.
Yeah, and
Some
some,
may be trying to contact a few, but
some LHJs have given that over to the Department of Health to do for them, and we decided that was really not kind of the Mason approach to things. So we're doing our things ourselves and actually maintaining those personal interactions. Massively scaled contact tracing, isolation, and quarantine. Not massively scaled, but we are scaled up here in Mason County, so we're doing okay there.
massively scaled.
Yeah, and that's again, this is a federal and state document, so,
And Mason County is special.
yeah. Offer voluntary isolation quarantine. We're a little behind on that, although we had contact last week with Peninsula Healthcare, who has some systems in place, especially for North End. 10 minutes from Belfair, they have a couple of facilities that are available for people who have been exposed and don't want to go home. So they have a place for them to go home and not take it back to their families. So that's working pretty well. And encouraging the public to wear masks. I have seen all kinds of masks. So people are out there wearing masks. They're doing their thing. An important thing to note on the cloth masks prevent you from giving it to somebody else. They don't prevent you from, so we'll come back to that when Frank and I have our discussion about what the county is going to do. Triggered move to phase 2, which is partial reduction in phase 1 steps. And this is, you'll notice that each of these has and. So sustained reduction in rates for 14 days and local hospitals can safely treat all patients without resorting to crisis standards of care. No one has gone to crisis standards of care, so we're doing pretty good there.
We should never went to stage 1 in the first place, according to this.
Well, and the capacity exists to test all people with COVID. Well, we're not there yet. And capacity to conduct active monitoring of cases and contacts, we're there. So we're really kind of looking at the first and the third. Once those kind of roll in, we start looking at that. And that's statewide, but depends on how the governor does things. Phase 2 goals is, of course, is to lift physical distancing, allow the vast majority of businesses and schools to reopen, and then continue to control COVID-19 so we don't go back to phase 1. Trigger to lift physical distancing is incremental in distancing measures. This could be done gradually, should be done gradually with increased surveillance for new cases. Restrictions eased with sufficient time between each adjustment to monitor for resurgence. What I talked about this week was if we put construction back on and we use construction as our test case. Construction goes on, we monitor construction, see what that does to our rates. If there's no changes, then we add the next thing. So, but it would be a good test study in social distancing and where we're at with cases. Okay.
That process, though, would take a long time. So if we waited for
within a couple of weeks, I think. So trigger for return to phase 1, that's what we're trying to avoid. Identify a resurgence in number of cases for 5 days. A substantial number of cases that can't be linked to known cases. So if they're linked to a known case, we expect them, that's fine. But if it's one that just pops up out of nowhere, that tells us it's still loose in the community and we want to watch for that. And then hospitals are no longer able to safely treat all patients requiring hospitalization. We've got that one down. We have plenty of capability right now. Mason General is at about 50% of their bed use, and they have the ability to add at least 20 more beds. We have the ability through public health to add 60 more beds, not including what we've done at building 10. So we've got plenty of capacity right now. So in the state, you're talking a total capacity in the state of about 4,900 beds, and we're using about 1,500 to 1,800 right now. So there's capacity in the state system as well. So
at what phase do you think they would start to allow for other procedures in the hospital again?
That's one of the things we talked about this weekend. We had a discussion with Department of Health on Saturday to talk about at what point can we relax, think, and get the dentist and elective surgery back working again. And that's going to really kind of come down to PPE, I think. PPE and testing is the part that's going to turn that back on. But that's certainly high on the agenda, is to get those things rolling again. Steps required in phase 2, implement case-based interventions. We've got that. Begin to relax physical distancing measures. Special care for vulnerable populations. And when I put that in, I have that in mind. State does too, but I've given it a little more thought. Food banks and all those infrastructure pieces that are being stressed right now, how do we make sure that those populations are taken care of, and how, do we know what they're doing, and then do we know what they need? So that's part of what we're doing this week, is to try to nail some of those things down. The next two are really coming from above, so accelerate the development of therapeutics, chloroquine or whatever they come out with as a treatment. That's going to come from above. Identify those who are immune, and we can't do that without getting the serology out there. We're not at that point yet.
How long before we can get that test, the 15-minute, half-hour test?
Well, the 15-minute test is here. The problem is the throughput on it is one test per 15 minutes. It's not multiple tests. So there are a number of those tests.
But for us, that's incredible.
Yeah, but
So-
a number of those boxes have come out, and they've gone, I think, to Seattle, to Snohomish.
But we don't have them.
We don't have them.
That's what I meant. How
There's-
long before we can get them? Because we can't.
I don't know. There's 15 boxes that have come to the state so far. So we don't have that capability yet.
Do we have anybody trained to do it?
As soon as it's allowed, Mason General will have their lab certified. So, but of the portable boxes, there's only 15 of them, and they're scattered across the state. Okay, those who have been identified through serology will be able to return to work, and then especially work in high-risk roles, so your healthcare, firefighters, EMS, law enforcement. Those folks want to look to make sure that they have the serology test done quickly. And then serve in those roles, like I said before, food banks and all those other things that keep our society functioning. We need to get those folks tested to see their serology as well. But again, that comes from above. Phase 3 goals is prevent infection, treat those with early disease rapidly. So if we have a positive case or cluster, we jump on that right away. Prophylaxis, that's going to come from above. If vaccine is available, that also comes from above. And the final goal is to enable the lifting of all physical distancing measures, and I put a little guy having dinner out with his pizza and beer or whatever there, so just to get people back out doing the things that they like to do. Thresholds for action is to trigger up and begin a scale of vaccine and therapeutic. And as soon as those are in and we've got the priority populations taken care of, switch towards the mass vaccination. Steps in phase 3 are just like they were with measles or any of these others that we've had in the past. That's produce it, prioritize it, distribute it, and then determine if it's working. It's pretty simple. And phase 4 is to come back and rebuild our readiness for the time around. And we're already talking about how many masks would be appropriate for Mason County to keep in stock. We're going to come out of this with masks and cots and bedding and all those things for shelters that we can stand up, and we'll have those, we'll be able to put it back into storage. So we'll come out of this in better shape for anything else that comes along, whether it's a virus or whether it is an earthquake or a fire or whatever. Anything that displaces people and starts to shut down systems, we'll be better in shape for. So I'd like to roll us back to this page. So this is my focus for this week, is to look at these at the state level and basically take each of these and make a plank. And off of this plank, we'll have what are our assumptions. So if the governor was to return us to, and say, all right, we're going to start relaxing one or more things, we don't know what order they're going to come in. So the idea is to build a plan and a can for each one of these things. So that no matter what the governor decides to do or the president decides to do, we'll have a plan of action, and then we'll have a planning assumption and then a list of concerns that would go along with that. So this is really at the state level. We'll get this done in the next couple of days. The next thing is to take this and expand it and look at what does this mean for Mason County, all the counties. So that will be a discussion with us, with the city, other parties, master builders, whoever. So at construction, for example, we had a plan for construction. Construction comes back, what are the assumptions? And those could change depending on what the governor does, but let's look at the assumptions and then what's going to be the reaction that we're going to have to do. What are the things we're going to have to tasks we're going to have to get done and get out there to make that thing work. So have a plan for each of those. And I intend to meet with the city and other partners this week. Commissioner, we're here. I went backwards in time. So again, this is the state level. I went through this, but what we want to do is build a plan and a can for each one of these things. And then we're going to add to that based on what we know Mason County would need. So after we meet with the city, have a much bigger discussion inside county government. So if construction gets turned on, what does that mean to local government? How do you bring back all your building inspectors? How do you bring back the front counter? We've got new systems we've been using. How do you integrate those new systems into what the new paradigm is going to look like? What's it going to mean for the assessor, for the treasurer? All those folks will need to go through the same things with each one of them and figure out what the county plan is going to be. So as Frank was talking about earlier, so if we bring county employees back, what's the PPE requirement going to be? If we assume that we stand up the whole county at the same time, or do we assume we're going to stand up like a rolling reopen? And then if we do a rolling reopen, say the courts open first, what does that mean? County government opens first. So we'll be working on that later this week, so we can have something a little more pinned down.
And hopefully it'll make it harder than it has to be. You know, if we have a real drop as it's looking like that we're having cases right now, if that can continue, that it'll be self-explanatory. If you've got, you know, 1/20th of the positives that are happening than what we even had when we started, it shouldn't be that hard. So I just hope we keep things simple.
No, our idea is to keep it simple, but to have a plan ready for whatever is relaxed first or in whatever order.
Right, I know some departments are already looking at theirs, so I don't think it's going to be.
I don't think it's going to be that tough. No. But just outline each plank and then assumptions and then reactions.
I'm from the government and I'm here to help and I'll figure out all your problems.
Well, we had that discussion, that very discussion on the phone this weekend, and it was a very robust discussion. And there are those who would like to have public health determine what businesses come back at what time. And there are others who are saying that's probably not the right approach.
I don't know, in this county, I'd be appreciative if the government would listen to that. I'd be happier than heck.
But it's all going to hinge on what the governor allows to relax and in what order. So we're preparing for that, and we've got the planning piece working on it. This week we're going to be really hitting some of those things like the food banks and other infrastructure pieces that we need to have in place regardless of what happens. You know, if this thing drags on, we need to make sure that those pieces are taken care of.
You know, that test that keeps going in my head, please look at options and bring us back an option. It may be valuable just to us as a county to find a way to invest to purchase it if that's what it takes, or something to be able to get that test mechanism here. Instead of waiting until it trickles down to our size or our...
As it gets approved, Mason General will have the ability to do rapid testing, but they have to go through their pieces first. So there's two separate things, and I think maybe we get them confused. There's the box, that will do one test at a time. It takes 15 minutes. Actually, it takes like 7 minutes to get a positive and 12 minutes to get a negative, but it takes a little while to process it. And they only do one test at a time. So
if we got one an hour, I'd be happy, to be honest with you. We only have somebody that we have to test, and after a while that becomes
right. And as more of those things are produced, more of them will come out. But right now the state has got 15 of them, and they've been distributed per the Department of Health. They've decided where those go.
And more of those are sent to the hardest hit
Of course, yeah. That's why I want to jump in front of them.
Yeah.
Oh, believe me, we're trying to jump in front.
Yeah.
Just keep an eye, if you see an opportunity, if it's financial, or sometimes it's not even going in the regular line of doing things.
I think our best key is if the lab at Mason General gets certified, and they can do them in, you can get the samples in the parking lot, and can do 35 a day, and get them done in a day, that's going to be a huge
And
increase.
Peninsula may even actually be certified before they are,
Yeah.
so we can.
Well,
also
Peninsula's
go
sending
north to
all
south
theirs
as well.
out.
Yeah.
Peninsula's not doing it, they're sending all of theirs out, but yes, it'll be through Kitsap County. So I think they send all of their testing through Harrison.
Yeah.
And the Harrison lab is, I'm sure they're gonna stand up like Mason General.
But probably a lot sooner. That's what I'm talking about.
Yeah.
I want to get the opportunity, first opportunity we have, I want to jump. I don't want to wait for it to come to our size. That's.
No,
where
we're
you guys-
working on it.
Oh,
Yeah,
yeah, it's full steam ahead.
Yeah,
yeah.
no, it's stuff we work on every day up there. So that's where we are on COVID.
You have one issue you need to figure out. For the last 5-6 days, you guys have been at odds with the state. You have 18, they have 19.
Well, yes, so WDRS went down over the weekend, and that's what, so it got inputted into the system, but it didn't transmit to us. So
We have 19.
So we have 19, so
So did we get it today, or?
we got it today.
Okay.
So, and part of the problem is, the State Public Health Lab is not entering into
It's a
the,
nightmare.
it's-
That's all every day.
their
5 times a day.
own system, they're not entering it into, the lab results from the Public Health Lab aren't going into WDRS, is my understanding, until 3 or 4 days later. So, where the other labs, we're putting them in the same, I mean,
And for some of the other information, we were stuck on the 3rd, then it broke loose, and it brought us all the way up to the 5th.
yeah.
Right.
No, it's, the state data infrastructure was not prepared, I think, for the amount of data that would come in through something like this.
And we spoke this morning about the tests that have been done, they haven't been tracking the counties. And so we may get an influx of positives because they were not, they didn't
Attributed.
have, yeah, they didn't have a box on there saying, asking them what county they were from. So they didn't put that information in.
So they're trying to track down by address.
Mhm.
And so there's, I think, 1,000 cases out there right now that have not been attributed to a county.
Yeah, but that doesn't bother me as much, because you were like that anyway, and then it got down to 63, and then it was back up to 800, and it was down to 124, and then, now we're over 1,000. So hopefully, we don't have that huge influx.
Mhm. Yep. Anything else?
I think that's it. It's been busy, so nurses are doing a great job. EH is helping fill the gap, and they're doing a good job. It's just, as in any emergency, it's always logistics and data. Those are the two things that always hang you up.
Mhm. Yeah, no, your group's doing amazing. They're putting in lots of hours.
Mhm.
Well, this is the first time we were backwards from the state, usually it's the other way around.
Mhm.
We were always, telling people, no, you can't listen to what the state says. I know that we have one more than that. And this time it happened backwards.
Yeah, so it's just the vagaries of data systems, and you go with the best thing you have and run with it.